So in this topic, we are going to discuss about heart's atrial and venous system. So atrial and venous system is nothing but the heart's main atrial supply, which comes primarily from the left and right coronary arteries. The arteries which originate from the aorta and which branches into smaller arteries which supply supply the blood to the different heart's regions. So venous drainage occurs through the coronary sinus and small heart veins, which ultimately drain a deoxygenated blood back into the right atrium. So arteries which carries the oxygenated blood and the veins which carries deoxygenated, which return the deoxygenated blood, and capillaries which facilitate nutrients and which is also a main purpose for waste exchange. And anatomy of arteries. Arteries are the blood vessels, which is the main thing which carries a blood away from the heart. The arteries are mainly divided into three main layers: tuna intima, tuna media, and tuna adventitia. Tuna intima, which is the inner layer, which is made up of which is an inner endothelial layer, which is smooth for easier blood flow, and the tuna medica is the middle layer, which is of a thick muscle layer which controls the blood vessels diameter. And next thing is tuna adventitia. Tuna adventitia is made up of which is the outer layer, which is made up of a connective tissue and which supports the blood vessel. And anatomy of veins. Veins are similar to arteries, but which is of which its structure will be thinner like tuna medica, and it has large lumen present inside the tuna medica. And capillaries. Capillaries are the smallest blood vessels which are characterized by a single layer endothelium membrane, and the absence of in capillaries the muscles and elastic tissue will be absent. It is a thin structure which facilitates efficient exchange of nutrients, fluids, and gases between the blood and the surrounding tissues. Blood flow dynamics. Blood flow dynamics, which refers through the arterial blood flow. Arterial blood flow refers to the movement of oxygen-rich blood from heart throughout the arteries to rest of the body, in which the pressure will get generated by the left ventricle's contraction. This flow is not constant. Okay, it fluctuates with the heartbeat. It differs with the heartbeat, which creates a pulse and which influences the blood pressure. So once if the blood pressure gets high, it is because of the ventricle's contraction only, and also with the fluctuations of the heartbeat. So high BP range is about 120 diastolic pressure, and 80 is systolic pressure, 80 mm per Hg. And venous flow. Venous flow refers to the movement of deoxygenated blood which is returned back to the heart through the veins. This is a passive process, and it relies on the factors such as like breathing, muscle contractions, and one-way valves to help remove blood against gravity. Low pressure or steady flow are aided by the valves and the muscles which is getting pumped. Coronary circulation is between the is differentiated into two supplies: arterial supply and venous supply. Arterial supply conducts place in the left coronary artery, circumflex artery, right coronary artery, and it supplies the oxygen with a myocardium. And venous drainage, it starts with coronary veins and it passes to the coronary sinus and to the right atrium. Portal circulation. Portal circulation, which specifies the hepatic portal system. It is also a unique pathway where blood from the digestive tract and spleen is directed to the liver before entering the systemic circulation. So this system helps the liver to process the nutrients and toxins which is absorbed by the food eaten by the person. And common cardiovascular disorders are which affects the blood flow. It is cardiomegaly, which refers to the heart's enlarged size. Coronary artery disease, which refers to the blockage of arteries. Valvular disorders, which refers to stenosis or regurgitation. And congenital defects, which refers to ASD, VSD. ASD is nothing but arterial septal defect. VSD is nothing but ventricular septal defect. These all will be shown in the through the diagnostic pathways. And arterial disorders are atherosclerosis, which is a plaque. A plaque will be built up in the arteries. And aneurysm, vessel wall dilation. Arterial thrombosis, a clot which blocks the artery. And venous drain disorders are nothing but deep vein thrombosis, in which blood clot will be present in the veins. Varicose veins, dilated superficial veins, and portal hypertension, which increases the portal vein pressure. So this is of the disorders affecting the blood flow will look like ASD, VSD, say coronary artery disease, and cardiomegaly. So these are atrial disorders. The plaque, which is shown at the yellow color, this is known as the plaque, and this is aneurysm, and this is thrombosis. And ventricular disorders are like this: deep vein thrombosis, varicose vein, portal hypertension. Thank you.